Okay. Before taking the questions, I would make a request to our former faculty and guest faculty to give their views during this webinar and also to address our media colleagues to be responsible reporters. So now I would request Dr. Mohan Isaac sir if you would mention any of his views.
Thank you very much. Thank you very much for asking me. It has been a wonderful webinar. I think it's very timely that the Mental Health Department at NIMHANS decided to, conduct this webinar with a lot of media personnel. I heard it during the welcome that all the important media outlets from Bangalore and other places, as well as trainee media personnel, are in this. I think the important points have been highlighted. Media has a very, very important role. I mean, the story of Spanish flu. Why is it known as Spanish flu? When people who have known about the Spanish flu epidemic, to which now we refer to, that was a time when the First World War was going on. There were media restrictions and media was banned from reporting not very good news. The only country in Europe which was not siding either side, either fighting side groups was Spain. And so initially when it was being reported, it was as if only in Spain this flu was occurring. And then, for after 1 century, even now, we refer to that flu as a Spanish flu, although it was there everywhere. So the point is that media has an important role, but I think the most important thing is what Dr. Chaturvedi mentioned, that, media, it can be like a double-edged sword. They have to have a balanced reporting. They have the important responsibility of informing people. In fact, now that I'm on leave, I'm not doing much clinical work and sitting at home. The first thing that I do is I get about 3 newspapers. I read it from beginning till end. And I also watch the news. Of course, Dr. Chaturvedi mentioned about, the dacoity and the dacoit being killed. But I've been also watching some other things with great interest. And this is the news of the gold smuggling, because it happened in Trivandrum, my home state. So there are lots of things occurring on and off, nice diversions. Of course, the Amitabh Bachchan, this morning we heard about Aishwarya Rai also. But I think the points made very importantly is that you have to play a balanced role. You have to inform the people, not sensationalize. There's also been lot of misinformation, which I get, of course, at home from my wife. What is good for COVID, what is the treatment, how can you prevent? None of which has been, actual scientific knowledge. So I think this has been a very important webinar, and all the media trainees who are here, I'm sure would have found this useful. Thank you very much for asking me to contribute. Thank you very much. I've enjoyed this.
Thank you very much, sir. So now I would request Dr. Avadhesh Sharma. So he was also the former faculty of NIMHANS, and also he is he is a resource person who has attended more than 100 broadcasts on All India Radio, and also to his credits, he has being the director and expert anchor of Man Ki Baat series on Doordarshan, which was mainly on handling mental health and psychosocial issues. And presently, he is the consultant at Parivartan Center for Mental Health. So, sir, I would request.
Let me introduce Avdesh Sharma. He's a very good friend, and he's from my medical college, Maulana Azad, and he did diploma in psychiatry here, and then he did MD. He wrongly got into psychiatry, but he is more of a showman. He's always been on stage, and now in spirituality that he has made a lot of contribution. Avdesh, it's a pleasure to see you, and we would like to hear from you. No. Yeah, Avdesh, you can give your comments.
Sir, you are a co-host, so you can unmute and you can speak.
He's not able to. Yes, sir. Yeah.
Okay. Thank you very much. Dr. Chaturvedi, I remember with fondness some of the things that we did in college. And also, uh, I think it's a wonderful opportunity to have attended today's session. I know the excellent work that has gone into the health education department under the leadership of Dr. Gangadhar and Dr. Chaturvedi, and now Dr. Meena, Lata, and Naveen. But what's more important is I think it's a big opportunity for all the media professionals. First reason is that when you come out of your media journalist or whatever courses that you do, the lowest priority used to be that if you have just started, you go to the health page, because that was the lowest priority. And as Dr. Chaturvedi said, that today it has become the first priority, political and everything else has gone down. But it is also an excellent opportunity for media and mental health professionals to come together and work together. Three, four reasons. One, the public needs it. Second, the numbers, if you look at, which is one in about four people needing mental health uh, support of some kind, and a much larger number of people today who are in distress, and they need much more help than only those who are mentally ill at this point of time. So we are talking about maybe half to two-thirds of the population. And frankly, most of the mental health professionals are not good at communication. uh, Most of us have not been trained in that, but you have been trained in it. So I think if we can partner together, we can provide the right information. You have the right skills to reach the public, and together it can be a win-win combination. One, to reduce the stigma. Second, to reduce the distress. And third is, don't forget that media professionals are also a part of the society. So if something is happening in the society, they themselves, as was pointed out earlier, that they also get affected in terms of their own mental health or their family's mental health. I have to keep, I know that the time is brief, so I'll give three basic suggestions. And possibly it can go from NIMHANS. Let us stop talking about the total number of cases. We don't say how many cases of tuberculosis have ever happened. So if you say 1 million people, it's very frightening. If you say only 350,000 active cases, it changes the perspective. Second, if we can tell very simple ways, today the whole public is going bonkers about what to do when something has come from outside. How much should be the distance when I'm walking on the road? What kind of immunity boosters which I should be having, which are not the concerns of mental health professionals in terms of mental illnesses, but they are the mental distresses of the public. And after getting the right scientific information, if we can, through the various media, make it available to the general public, I think that will be a big, big support. And the third, but possibly the most important, is that this is the right time to talk about the mind body soul connection. There are already resources which are there in the community. I have been working for last 25 years with many spiritual organizations, and we have found that people would like to listen to influence makers, whether it is media professionals or it is television or uh, Bollywood movies or other movie professionals, or it is highly spiritualized professionals. And having interacted with them, I realized that most of them want to do good, but some of the times they don't have the right scientific information. And lastly, I think for my mental health colleagues, we have to learn to start giving out information in ways that the general public can consume. Not the scientific jargons in terms of percentages, but something that is on a day to day basis useful for the public at large. And I think we need to start having a little bit of a capsule in the training of the mental health professionals, so that in future this would be something that they would have to be dealing with, and especially the social media. We are working a lot with the social media. It's a different world out there, but that's the world that people are getting influenced by. So it's time that we learned to deal with the problem even through that media with the help of the media colleagues were there today. Thank you very much for a very, very wonderful seminar by NIMHANS and by the department.
Thank you very much, sir, for the insightful words and also for your for lot of extending your hands of support to the media. And now I would request Dr. Gururaj sir to give his views about this webinar.
Yeah. Can you hear me?
Yes, sir.
Yeah. Thank you very much and good evening, everybody. It's been a wonderful seminar, especially at this time when there is need for proper and correct information that should go out into the public. I think my colleagues, all the speakers have given very good information in terms of what resilience is, what the pandemic is, and what to be communicated, what not to be communicated. Those details have already been given. I just would like to highlight three important points. One is all of us are in difficult times. Like Santosh said, home is the place where everything is. But in many of the houses, even the windows are closed and doors are locked. So people are just stuck inside their houses and doing all possible activities within the houses. Second important development that has happened since the beginning of the pandemic has been that the information that has gone into the public domain has been huge, and any news channel, any newspapers, print media, or social media channels are all flooded with information of different types, and it becomes difficult for a common man to really sort of see this information and to get what he wants to do or what he should be doing. An important thing that needs to happen on all fronts is some responsible reporting, communicating the right type of information. In fact, one of the things that I always say is we should stop showing this virus dancing in the air. In some of the channels, we see this virus of different size, shape, color, spikes, and against different backgrounds that keeps on floating all throughout. And I think for an ordinary person who is not a scientific person, who does not understand the complexities of this pandemic, it becomes very difficult and it also puts in a lot of fear in their mind. And especially it is important, there are three things that the media should sort of give it a serious thought. One is we have to move beyond these numbers. There is a very large focus on communicating numbers in terms of different tables, different colors, and that comes from different sources, sometimes which can be very misleading. And this creates a lot of fear in the minds of public. We need to understand that every human being is different. They all have their different emotional abilities, their different ways of handling information, the way information strikes them and disrupts their life. So we need to understand that, and we need to move beyond numbers. And numbers, especially in this pandemic, are relevant only in some areas, and that needs to be communicated in the proper way. Second important thing is there are many complexities in this pandemic in terms of the test positivity rate, the testing, tracking, treatment. All these things, they are very different. And a common man needs to be told in terms, the public needs to be told in terms of what is relevant for them. If it is something that is not relevant to them, either they will not listen to it or read through it or even listen to it. So it's important to communicate what is relevant and what do we expect people to do. That is important because it is flooding public with large amounts of information does not really make sense when actually it is not being followed. The other important issue is the look for correct information. In fact, if we run through five different channels or five different newspapers, we get different information in terms of what is happening with regard to the pandemic. So there has to be the media professionals need to spend some time in getting the information, in analyzing this information, interacting with other health professionals to get what is right and what is wrong, what to be reported and what not to be reported, and how to report it and how not to report it. There needs to be some time that needs to be spent in understanding this and then communicating this and sort of avoiding the sensational news events that are being communicated. It requires continuous engagement from both the sides, from the health community and from the media community, to work together to take the proper information to the public. And building on the positive side of this is very, very important. It is not that everyone, there's no point in showing dead bodies being thrown into a gutter, and it's not happening all over the country. And in fact, if you look at the death rate, it is less than 2%. So why should it be shown that way? It creates, fear, hatred. It creates sort of apathy, all sorts of mixed reactions. Evokes in the minds of public. So it's important to figure out what needs to be communicated and how it needs to be communicated, and it requires both the professionals working together and then taking it to the public. It should go beyond the TRP ratings or the newspaper sales when it comes to a dire situation like this. It is sort of helping the society, help protecting the people, and seeing that people are not affected to a greater extent and their lives are not disrupted to a big way. And that's what is important, and the focus should be how can we come back and how can we be stronger and how can we building resilience does not just happen like that. It requires bringing in a lot of positive things into the society, into people's lives, to reassure them, to give them that confidence, to give them that strength to face it, and to take the appropriate actions that needs to be taken. So I think this has been a very useful and a very interesting webinar, and I'm sure many of our media colleagues would sort of take this up seriously and sort of communicate this in the coming days. Thank you very much.
Thank you very much, sir. So Dr. Gururaj sir was a former HOD and former Dean Neurosciences from the Department of Epidemiology. So to his credit, he has worked with a lot of helping the WHO in making the guidelines for responsible reporting, and also about various guidebooks and training materials on preventing suicides. So thank you very much, sir.
Thank you very much. Thank you.
Now I would request Dr. R. Srinivas Murthy, former professor of psychiatry, to speak a few words, sir.
He's not on video, sir.
He's not there. Not there. Huh? So,
Well, there are some questions which have come, and I think a lot of them were already taken up by the do's and don'ts. First is by Sakshi Parihar about how can media protect people who are facing social ostracism and negative vibes. And do you think there is a need to regulate? So I fully agree with you, but I don't know. I have only one suggestion, which is a behavioral suggestion. If the media highlights places where this doesn't happen, or it shows that in so and so place, the people who have the COVID-19 were actually supported by their community, and because people want to be in news, so if they come in news for a positive reason, that will spread the word, and more people, more organizations, the RWAs and the societies would like to do that. And I already mentioned that there is a need to regulate. If I had my way, yes, of course, I would have said that there should be a lockdown on media. Dr. Prakashi Rajaram has asked about what is the solution for overexposing in the present crisis. Madam, it is out of hand. As far as I can see, that it is only self-regulation. That's what I do is, and as Dr. Mohan Isaac was saying that, he also regulates himself. We need to regulate ourselves on how much exposure we get. Otherwise, this will drive you crazy. Thirdly, Mr. Rahul Prasad, he has asked about that while reporting on ground situation, how to maintain a controlled emotional involvement. Rahul, you yourself have a media house of daily report, and I think you do it quite well. There has to be a balance of emotion, because unless there is the ethos and the pathos and a rational reporting in a particular situation, there has to be some amount of emotions, but it should not be excessive and it should not be negative. And one way I would suggest is that if you think that suppose I was receiving this news, how would I feel? Then it might be what making it more balanced. Other questions? Dr. Naveen has
Yes, sir. I think so.
The question is, sir, by Sunita Rao. She's a reporter from Times of India. Madam wants to know what are the researches being done at NIMHANS presently. And she's also mentioning lockdown has been seen as the biggest mental health experiment. And she wants to know.
Yeah, as regards the research that are already going, I think from the psychiatry department I can speak. Of course, many other departments are also involved, but we can talk about them. As regards psychiatry, it's a service come research activity that we are doing, because this lockdown, as you have rightly pointed out, has presented a lot of challenges. At the same time, the opportunities also, the windows open up. For example, the OPDs had to be closed down because of various reasons. At the same time, it gave us a lot of opportunities to connect to our patients through virtual means. So we started what is known as the continuity of care program, through which we have reached about 20,000 patients before the OPDs, of course, open up again. So we're in the process of writing up what were the experiences, both in terms of the audio consultations as well as the video consultations. And our department also is involved in coordinating the national psychosocial helpline, national helpline for psychosocial support and mental health services. That itself is a big experience for us. More than 3 lakh calls have landed up into that helpline, and of course more than 50,000 patients have been rendered some kind of a service. So a whole lot of experiences we have on that. We are in the process of writing them up, and the other thing is that our department as well as the institute is involved in coming up with the operational guidelines for telepsychiatry practice. So our department and colleagues were intimately involved in coming up with those guidelines for telepsychiatry. And of course, not only with regard to psychiatry, we have worked with various other departments, including psychology, social work, and nursing. So guidelines on how to practice using digital technologies across all these 3 departments, that also are in the process of coming up. So I think that is it from my side.
Yeah, see, we are not a COVID hospital as yet. So in terms of research, I can say that our virology department is very active, virology and microbiology, and they have already published a report on the epidemiology of the occurrence of the virus and how it has come and its movement. So that is one of the major things. Most of these studies are because of the hospital being very restricted and what was closed for a long time, that the studies on patients have been much less. So what we have been doing is mainly online surveys, and many surveys have been done. Some are already published, others are getting published, and we are now also trying to look at the neuropsychiatric complications, both short-term and long-term. So these are still early days, but we will come to know as time goes by a lot of clinical work and clinical research which is there.
Also, yes, sir. Also, we have been able to liaise with the district mental health program of Karnataka, so that we were able to link up many patients to the respective DMHPs that we are in the process of documenting. The other thing, what we did for NIMHANS patients, particularly who are residing within the vicinity of 3 kilometers, we actually actually liaised with the BBMP, Brihat Bengaluru Mahanagara Palike dispensaries. And then many patients, our patients, we asked them to go to those PHCs or the dispensaries, and the medications were dispensed then. That is a time when we took some opportunity to train those doctors also, in-person training, a little bit of training we did, and more than 2,000 patients have got benefited out of that. So that also we thought as an important experience. We are writing up that experience also, that can be taken up as a research activity. The other important thing is the yeoman service that the Karnataka state government has done with regards to the DMHP. What all activities the DMHP did in this period of lockdown. There are a number of activities that they did, including telephone calls, the outreach services. The ASHA workers have gone and delivered medications to patients' house when they are not able to reach the PHCs. So all these experiences also we are in the process of writing up. It's not a hypothesis-driven research or hypothesis-generating research. As I was telling previously, it is a service come research activity. The services, whatever we did, we thought it is very important for us to document all these things, and we are in the process of that. Thank you.
So there is one question by Simon Varghese. He is from National School of Journalism. He wants to know that does the panel feel that COVID-19 got much more media coverage as it affected the rich first?
Well, I would agree with that. I think it got media coverage because of the vastness with which it spread and the extent with which it had affected people in a very short period of time. But this is an observation which you have made is quite right, because as of now, most of the things are actually being done for the middle class and above middle class, and they are the ones who are a target of attention. But people who are affected are obviously, as we saw in the recent few weeks, the migrants, the people who are underprivileged, people who do not have, we talk so much about the masks, but one of the other things which nobody talks about is, including the media, is then how will people wash hands? In our country, at least 30 to 40 or 50% of people who are poor, they struggle to get drinking water. And they go to these, these vans which bring and give water. Well, where will they get water to wash hands and to wash it multiple times? Corona has turned out to be a very, very expensive disease. Everything about Corona is expensive. The sanitizers are expensive. The soaps are expensive. The investigation is expensive. The treatment is very expensive. Hospitals are expensive. So it is actually turned out to be, I can only compare it with cancer. Cancer is an expensive disease. Now, Corona is turning out to be a very expensive disease, at least for the individual. So, you want to add?
Yes, sir. So to add on to that, maybe one reason why you're thinking like that is because it came through, outside, overseas. So that is when it actually entered our country through the air travel, and first, in first 10,000, 20,000, whatever cases actually were happening through this. But now, I don't think virus distinguishes between the rich and the poor. In fact, the conditions are there. If anybody does not, in any community does not practice, public health measures, of course, it is not sparing anybody, no rich, no poor, nothing. That's what I.
There's one more additional question. This is directed to Dr. Gururaj sir. They want to know that can NIMHANS work with government and TV channels, media organizations to issue binding guidelines that will be taken seriously by everyone? Gururaj sir, can you hear me?
Yes, we are.
Sir, sir, kindly unmute it from.
Yeah, Dr. Meera, can you come back again?
Sir, there's a question that they want to know, can NIMHANS work with government and TV channel media organizations to issue binding guidelines that will be taken seriously by everyone?
Yeah, see, basically there are a lot of guidelines that are already being provided by different national agencies and international agencies. For example, WHO, UNICEF, UNDP, All United Nations organizations have provided guidelines, and there are a whole list of things that the media can practice. Secondly, even by some of the Indian organizations, there are a couple of guidelines. NIMANS would be happy to work with these agencies and with the ministry to develop and sort of share these guidelines. But NIMANS is not the implementing authority when it comes to actually putting it in place. NIMANS can support, can help, and can work with media agencies in translating these guidelines into actionable areas. That's a possibility, and definitely we'll be very happy to do that. Along with this, there are also other guidelines that are available through the national TV and the media guidelines, which are equally important and which are sort of detailing some of the ways by which media can be more proactive, can be more positive, and can also be reporting things in a different way. Uh, that I think we'll be very happy to do it and help the media professionals in sharing this information.
Thank you, sir. There's one more question by.
Can we request any of the media professionals or media faculty to mention their views about this webinar? You can raise your hand so that we can unmute you.
By then we can just take the next question. We have one question by Raghava Young here. He's asking that there are deaths of those suffering from COVID-19. How can we report it in a way that encourages those suffering from COVID to come forward to take treatment?
Yeah, okay. Can I respond to that?
Yes. Yes.
Yeah, see, basically in this entire COVID pandemic, especially with reference to India, there have been a few deaths, and our mortality, our death rate is still very low compared to many other countries in the world, especially with the high income country. It is between 1.5 to less than 2%. It is in that number. But unfortunately, these deaths are occurring among people who are predominantly 60 years and above, those who are having comorbid conditions like diabetes, hypertension, respiratory disease, immunosuppression, and many of these things. And it is also happening in places where the medical facilities are relatively scarce. An important observation and the data that has come out through several rounds of discussion is that people are reporting very late to the hospitals. And when people reach the hospitals very late, in an advanced stage of illness, it becomes very difficult to manage, because right now we don't have very proven and effective drugs that are available to entirely cure this disease. So that being the situation, there are different ways by which media can report very positively on this, informing the elderly, informing those who are in immunocompromised states, those with comorbidities. It should happen in 2-3 ways. Number one, basically in terms that elderly should protect themselves, and elderly should be protected by other members of the family. All precautions must be taken on both the sides to see that the infection is not transmitted. Secondly, elderly people must be very cautious when it comes to their health, keep their health in very good condition, in a good positive state. And thirdly, be on the lookout for the presence of any symptoms. And if these symptoms continue or develop, they immediately need to report to nearby health facilities and get that. Keep a list of all the available help that is required ready on hand, so that they can contact these agencies at a very short notice and make the necessary arrangements. They can also influence the government to make facilities available to these people and to prioritize the help for them. Most importantly, elderly people and their family members need to protect their mental health, because it is the fear, the panic, and the crisis that gives rise to a lot of mistakes that commonly happen in these situations. they need to be informed about it. And I think it's important for the media to communicate this in a very positive and a responsible manner without creating fear, psychosis, and stigma in these people. And I think these are some ways by which the deaths can be reduced or deaths can be prevented. And that's very important, and it requires action by everyone in the society to do this in a very significant way.
Thank you, sir. There's a question especially for Dr. Naveen. Bala Chauhan from the New Indian Express wants to know, is it stigma or fear that is there in the society, and how is it that?
No, I think Bala Subramanian.
Bala Chauhan.
Bala Chauhan, sorry to spell your name correct. I think it's always a chicken and egg story. So stigma leads to fear and fear leads to stigma. So it is a bidirectional relationship. I don't think one is private to, one is primacy, one is the other. I don't think it is that way. So, but if one we deal with, the other also will come down. It is like that. That's what I feel.
Okay.
Okay, I think we have answered most of the queries. So other queries we would be replying to your emails. So thank you all for the active participation. I thank all the participants. I thank all the resource persons. I thank all the media professionals and media students for their active participation. And I would also mention a special thanks to all the former faculty of NIMHANS for their active participation in this webinar. And I would like to thank our director, sir, and the Department of Mental Health Education, and all the other faculty and students from NIMHANS for making this webinar a success. So I would request all of you to reply to the poll, and we would also be interested to hold such programs in future. Thank you very much.